siguiente presentador será el doctor Rodrigo Matos. Él va a presentar en el tratamiento no quirúrgico de los pacientes fisurados durante la adolescencia tardía. Rodrigo.
Good afternoon, everyone. First, I want to say thank you to Smile Train for this invitation, especially to my friend Roselena. It's a great pleasure to be here today. I'm here representing a foundation that treats cleft patients in Brazil. This foundation is located in the south of Brazil, in the city of Lajeado, Rio Grande do Sul. It's called Fundef. It's important to say that we have an orthodontic program in this foundation where we treat and teach how to do everything that we will be showing today. Well, when I talk about non-surgical orthodontic treatment of patients with clefts during late adolescence, we need to ask two questions. Which are the needs of these patients, and which are the possibilities for these patients? And after this, I need to know which surgeries have these patients gone through. And it's still possible to do any orthopedic treatment in these patients. And which are the possibilities for the cleft region? Usually the main needs for these patients are correct the anterior crossbite, because the most of these patients have skeletal class 3, correct the midline. These patients have midline deviation to cleft side, leveling the occlusal plane, and define the conduct for the agenesis region. Prosthesis, implants, space closure. Our goal today is present a series of patients that illustrates some of these possibilities. Okay, patient number 1. He was 13 years old. He come from another service, and he had many surgical sequelae. And in frontal and lateral view, we can see an important maxillary deficiency and a concave profile. Intraoral view, we can see anterior and posterior crossbite. And here, we can see a transposition between premolar and canine, incisor agenesis, right side, and left side presence of supernumerary teeth. And panoramic radiography. And here, when we look at the profile radiography, we can see a severe skeletal class 3 and maxillary deficiency. And when you look at this image, I think this is a surgical case, and it is. But why not to try some orthopedic treatment and improve this profile? And it was what we did. We used a McNamara expander and a petit facial mask. And after some months, we can see a very important change in the groove pattern. And here, before and after expansion in protraction, and the change in profile, and frontal view. And after this orthopedic phase, we started the orthodontic treatment with acrylic appliance to do intrusion of the incisors and extrusion of the posterior teeth. Occlusal view the appliance. One more step of orthodontic treatment with brace. And when comparing radiographies during treatment, we can see the improvement and the stability at this moment. And the same in the face. Another step of orthodontic treatment. Here we did extraction of the premolar and accept the transposition between canine and premolar. And one more step here, we decided to do the extraction of lateral incisor because of its poor root pattern and close the space. And here we can see the premolar in the place of the lateral incisor, right side, and left side we can see the canine in the place of the lateral incisor. Occlusal view, and here the final with a good occlusion, good result. Occlusal view, and the patient was 17 years old with a pleasant smile. Panoramic radiography, final, lateral radiography, and here 3 years follow-up with aesthetics. And the patient was 20 years old. And before and follow-up. And here before and follow-up. Occlusal view before and follow-up. And before and follow-up, we can see a good stability. And okay, patient number 2. Another space closure using the premolar. This patient was 15 years old. 15 years old. He had a unilateral cleft lip and palate. Intraoral view, we can see a genesis, the lateral incisor genesis, and transposition between premolar and canine. And at this moment, we need to decide what to do in the cleft region, prosthesis, implants, space closure. When we see bone graft region, we can see was not really successful. So the bone in this area is not really good. But even so, we decided to close the space. In this kind of situation, it's important to reduce the speed of movement. And already the space closed. And occlusal view. In this kind of situation, it's important to do some occlusal adjustment in the palatal cuspid of premolar. And here, before and after the closure. And before and after, showing a good bone control. And here the final, with a good occlusion, good result. And occlusal view. And radiography. This case was published in Dental Press Journal of Orthodontics. Patient number 3, one more option, the implant, use of implant in the cleft region after tertiary velar bone graft. And the patient was 17 years old. She had a unilateral cleft lip and palate. And intraoral view, we can see anterior and posterior crossbite. In the occlusal view, we can see a severe maxillary atresia. And here, in radiography, we can see the need of the tertiary velar bone graft. So the treatment plan was maxillary expansion. So then correction of the anterior crossbite by the projection of the incisor, then tertiary alveolar bone graft, then implant. And here we can see showing a good evolution. We use the open coil to projection of the incisors in the open the space to implant. Occlusal view, panoramic radiography, tertiary bone graft, and the implant in the cleft region. Final, occlusal view with the implant, and before and after. Before and after, the patient with a good smile. So the implant is another good option for these patients. And one more, patient number 4, use of supernumerary teeth in the cleft region. This is a younger patient, but I think is important to show because we used another important option for these patients. He was 80 years old, and he never received any treatment. And first step was lip surgery. And when you see the intraoral view, we can see a simple cleft. Again. And here we can see needed for bone graft. And we can see a thin or small, fragile, supernumerary teeth. And at this moment, we talked to the surgeon and talked to the surgeon to keep this supernumerary teeth in the bone graft surgery. And we started the orthodontic treatment with a removable appliance until correct the incisor position. After this, we started the traditional mechanics with brace, and here yet included the supernumerary teeth in the appliance. And here we can see the very good result, the bone graft, and the good result, the supernumerary teeth. And the final, with a good occlusion, good result, occlusal view, and the patient happy with a new smile. Before and after. So use of supernumerary teeth is another option for these patients. Patient number 5, orthodontic leveling of premaxilla. This patient came to us when she was 13 years old. She had a bilateral cleft, and she never received any treatment. We can see the big difference between premaxilla and posterior teeth. And occlusal view, we can see an important palatal fistula. And at this moment, we need to decide what to do for treat this patient. I no doubt the surgery is an option, but orthodontic leveling is another possibility. It's hard, but it's possible, and it was what we did. So after leveling, we get to this point to just reducing this step in traditional mechanics. The smile of the patient after leveling. And to improve the smile, we use the two fake teeth and a good art. And here, in radiography, we can see a good root control, and at this time, the patient is ready for alveolar bone graft, tertiary alveolar bone graft. And here, before and after leveling, and one more time the smile. And patient number 6, another orthodontic leveling, but in this case, untreated adult patient. And this patient came to us when she was 20 years old, and she never received any treatment before. And when we look at the intraoral view, we can see a hard situation that make it impossible to repair the lip. And occlusal view. And we started the orthodontic treatment with expansion. And to level and to retract the incisors, we use the segmented arch. And after to improve the incisor position, we use the continuous arch mechanic. And here we can repair the lip. And one more step of orthodontic treatment. Different phase, different moments, and different moments in occlusal view. And the final occlusal view. And the patient happy with her new smile. Before and after. Thanks so much.